Chain Drug Review and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello everyone, I'm Jeffrey Wolt, Editor-in-Chief of Retail Media IQ. Welcome to a special edition of our video forum. We're here in San Diego at NACDS Total Store Expo talking with industry leaders. One of them is Sandra Hanna, CEO of the Neighbourhood Pharmacy Association of Canada. Sandra, great to see you.
Thanks for having me, Jeff.
My pleasure. Earlier this year, your association celebrated its 30th anniversary.
Yep.
Maybe you could talk a little bit about its impact on the evolution of healthcare in Canada over those 30 years.
Well, we've seen incredible advancement in pharmacists' scope of practice and the role that pharmacists can play across the healthcare system. And I think what we're specifically excited about is our role and our leadership in making sure that the pharmacy, which is really the home of those pharmacy teams, continues to be a destination for healthcare. And we've really turned pharmacies into a destination where people get their medications, to a destination where people get primary care, public health, and other health and wellness solutions and advice. And I think I'm really excited to see how that continues to grow.
Maybe you could tell our U.S. audience a little bit about Alberta in particular, since it seems to be very advanced in pharmacy care.
Well, Alberta has been really leading the charge in terms of scope of practice in Canada for over a decade, almost a decade and a half. We've seen a lot of advancements. Other provinces in Canada have really been looking to Alberta and have caught up in some ways, and in some provinces even surpassed Alberta now.
Really?
So,
which provinces are those?
Nova Scotia. Nova Scotia is doing some really exciting things now, and really advancing scope for pharmacists and pharmacy teams, and really positioning pharmacies as primary care clinics and hubs for healthcare delivery. So, Alberta has been really the leader, and we have them to thank in terms of leading the charge. But we don't want to stop there. We want to continue, and I think we've got some great momentum, and hopefully we can continue that progress and continue to grow the role of pharmacies as health hubs.
The pharmacists can almost act as a primary care.
Independent prescribers. They have full prescriptive authority under their scope, and they have the authority as prescribers with advanced practice to be able to initiate medications for just about anything that they are comfortable for. Wow. So they are limited not by scope and regulation, but by their own professional judgment and capabilities and comfort level.
I'm sure the chains here would love to get to that point in the U.S. someday.
Well, we're seeing some great advancements. I think we're seeing some great advancements in the U.S. and we're working very closely with a lot of our U.S. colleagues to compare notes and share learnings, because I think there's lots we can learn from one another when we work together.
Absolutely. When your organization was founded, it was known as the Canadian Association of Chain Drug Stores, and obviously you focused on those retailers.
Yeah.
Subsequently, you broadened out to include independents in that mix. Has that changed the mission in any way, or?
I don't think it changes the mission. I think it just recognizes that at the core of what pharmacy does, what we want to be is trusted, accessible healthcare destinations. And whether you are a chain pharmacy or an independent pharmacy or a specialty pharmacy, you may specialize in different areas of care, but ultimately we have one united vision, and we want to be that destination for care for Canadians. And as an association, we are there to represent and ensure the sustainability of all those pharmacies, and frankly, to ensure that those businesses and those pharmacies thrive as healthcare providers. And I think that our expansion from chains only to chains and independents to more recently specialty pharmacies under our representation really helps us to be a trusted partner to policymakers, to other stakeholders in the sector. More recently, we've expanded even further to include in our work and to inform our work a number of partners who represent other stakeholders in the supply chain. And that's been incredibly valuable for us to inform our advocacy and our solutions, and has really made us trusted partners to government and policymakers, because it represents the entire sector, and we are the only association that represents the full gamut of different pharmacy business models, and that's been a real unique differentiator for the perspectives we bring to the sector.
And so this unification has increased your lobbying ability and your persuasiveness with legislators and regulators.
Absolutely, absolutely. I think it allows us to say, we have consulted with the different stakeholders and the different business models in the sector, and we can bring solutions forward that represent the entire sector as opposed to just single corners of the sector.
You recently unveiled your strategic plan,
Yeah.
Prescription for Success.
Yeah.
Tell us about what's in there.
I think at the core of that, this new strategic plan, which was launched this year, is ensuring that pharmacy continues to be an innovative and integrated healthcare provider in the healthcare system. It's about modernizing pharmacy and, frankly, about future-proofing the sector to be a critical partner in the delivery of care in Canada. So we're particularly excited. It focuses on 3 pillars: leadership and advocacy and research, business success and sustainability, and innovation and integration. So we're really looking at the full gamut. How do we move things forward? How do we ensure that we are set up operationally to deliver on all of the promises we're making and all the things we know and the value we know we can bring to the healthcare system? But really looking at how do we support our members in doing that.
And here in the U.S., pharmacies want to be the front door to healthcare, if you will. You seem like you're well on the way to that in Canada, yes?
Yeah, we're definitely getting there. I think we are certainly the first choice for vaccinations in Canada, certainly the first thought for vaccinations. We're really growing in our ability to deliver on primary care too. Every province has now enabled prescribing for minor ailments, and those services have taken off exponentially since they've been launched in the final few provinces that have launched them. People are really looking at pharmacy differently. I think the public and policymakers are really looking at pharmacy as a critical partner in the delivery of care. And so I think we need to continue to ride that wave of momentum, and we are working hard to continue to position pharmacies in that way.
In that expanded scope, how has that affected the physician community? Has it relieved a burden on them?
Well, we've seen in Nova Scotia that I mentioned earlier in terms of some of the expansion in scope, it has relieved the burden on other areas of the healthcare system. These new clinics, they were piloted a couple of years ago, and they have actually demonstrated up to a 9% reduction in emergency rooms, for example. So they are definitely having an impact on healthcare system capacity, and we know we're just scratching the surface. So we're really excited about what's to come here.
You should be. Here in the U.S., there's a lot of controversy over vaccinations. I notice Alberta also is restricting access to COVID shots. Is that it?
Yeah.
What is your organization doing to fight that trend?
Well, I think, listen, we see vaccines as a critical tool in the toolbox for healthcare, obviously. And we know that Canadians love going to their pharmacy for vaccination services. So we're continuing to push the importance of pharmacies as destinations for vaccinations. We actually are members of an alliance in Canada called the Adult Vaccine Alliance, where we are playing a leadership role, bringing together public health experts, other healthcare provider experts and leaders, and pharmaceutical manufacturers and vaccine manufacturers to continue to drive forward the importance of equitable access to vaccines, as well as more delivery systems, and that includes pharmacy to ensure that vaccines are available to all Canadians. So it's not just about vaccine, but it's about equity, it's about healthcare, it's about prevention, and it's about everything that we stand for, I think, in pharmacy.
Well, sounds like you have great momentum, and thank you for filling our audience in on it.
Thank you. Thanks for having me.
Okay,
Yeah,
no
great
pleasure.
to see you.
Thanks
Thanks
so
so
much.
much.